Hi, you guys. Welcome back for our daily practice questions. It is day 56, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. All right, question number 1 states a 48-year-old male presents with a BMI of 29. Fasting blood glucose of 110 milligrams per deciliter, and an A1C of 5.9%. He reports a sedentary lifestyle and poor eating habits, but is motivated to make changes. He has a family history of type 2 diabetes. What is the most appropriate first-line therapy treatment for this patient to prevent the progression to type 2 diabetes? Is it A, metformin, B, lifestyle modifications, C, insulin, or D, oral sulfonylureas? Take a moment and tell me what you got in the comments, y'all. All right. So y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, what is the most appropriate first-line treatment for this patient to prevent the progression to type 2 diabetes, right? All right, so all in all, it's asking for treatment, the first-line treatment at that. So I always tell y'all, if they're asking for treatment, we need to run it back and see if they provided us with a diagnosis. And if they have not, then you have to run it back a step further and look at those assessment findings so that you can determine the diagnosis, right? But it also says here, what is the first line treatment to prevent it from progressing to type 2 diabetes? So this must mean that the diagnosis is pre-diabetes, right? Because that's the only thing that would progress to type 2, right? So making sure you're paying attention to wording and what is being said here. And if you struggle to confirm that, you can go and look back at the fasting blood glucose and the A1C. They both fall into that pre-diabetic range. So the benefit of that is now that you know where this patient is and what their current diagnosis is, what are you going to tell somebody who has prediabetes? What do you tell your patient in front of them, right? You're going to start those lifestyle modifications with the diet and exercise education for them, correct? So B is your best answer. Question number 2. A 55-year-old female is newly diagnosed with type 2 diabetes. Her A1C is 7.8%, and her fasting blood glucose is 155 milligrams per deciliter. She has a BMI of 32 and reports that she is not exercising regularly. What is the first-line treatment for this patient? Is it A, insulin, B, metformin, C, a GL1 receptor, or D, sulfonylureas? Take a moment and tell me what you got. All right, so stem of the question here, what is the first line treatment for this patient? So, okay, treatment, we need to run it back and see if they provided us with a diagnosis. And it does. It tells you that this patient was newly diagnosed with type 2 diabetes. So, easy enough. What is the first line treatment for type 2 diabetes? That's all you need to hone in on, right? And the answer is B, metformin. Remembering that first line therapy for our type 2 diabetics is metformin, also known as glucophage. Know both names, okay? And question number 3. A 62-year-old male with type 2 diabetes and a BMI of 35 presents for follow-up. His A1C is 8.2% and his fasting blood glucose is 160 milligrams per deciliter. What is the most appropriate first-line treatment to manage both his type 2 diabetes? Is it A, insulin therapy, B, metformin, C, thiazides, or D, GLP-1 receptors? Take a moment and tell me what you got. All right, you guys. And so the similar question here is, what is the most appropriate first-line treatment to manage his type 2 diabetes? Y'all take the both out, because I was about to make this question a little bit deeper and I changed my mind. And I took parts out of my question and I did not take the both out of there. So just, I always like to build on the questions. And so I wanted to give you another tier. I wanted to make sure you understood this level first before I have it. So if anything, this tells you how deep I start to think on ways to help y'all learn and retain. But forgive me and exclude that both. But this also shows you that I record and I don't I don't edit. Oh God. But yes, stick with me. Sorry for the rant. A 62-year-old male with type 2 diabetes and a BMI of 35 presents for follow-up. His A1C is 8.2% and his fasting blood glucose is 160 milligrams per deciliter. What is the most appropriate first-line treatment for this patient with type 2 diabetes? What do y'all think? And y'all, it's the same scenario. It's still metformin, okay? Metformin will still be the first line for this patient. So in this, I was going to step it up and add some more factors to it and build on the metformin piece, but we'll be doing that tomorrow. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And as always, if you need anything that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions or any of my question analysis or custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.